an assessment for malnutrition and frailty. This assignment is going to give you real-world experience with interviewing people and doing assessments and reflecting on what we've learned in class about ageism, views of older adults, changes in physiology, and connections to theories of aging. Read the steps below. The objectives is to provide an opportunity to have a positive interaction with older adults, identify concepts learned in this course, and practice using the mini nutritional assessment and frailty scale. The first step is to find the person you want to interview. It can be anybody. It can be anybody over 65. It could be a coworker. It could be a family member. It could be somebody you know, a neighbor. It doesn't matter as long as they are over 65. Keep their information confidential by using pseudonyms and initials, and include a short introduction detailing their gender, approximate age, occupational status, and cultural background. Add 3 of your own original questions. Include a copy of the interview in the uploads here for this assignment, and it can be written or voice recorded. Both you need to make sure that you're getting consent to do the interview and to record any voice interviews. If you don't do this, that could be a failure to maintain privacy of the interview, and therefore marks would be lost. So these are the questions, and then you add your own. And then step 2, you're going to do the mini nutritional assessment and the frailty tool, and that was in week 5, the module on frailty and malnutrition. You'll find more on that information on both of those tools there. You're going to submit a copy of each of these tools completed, and which are worth 2 points. And then you're also going to include whether or not the person's malnutrition, at risk of malnutrition, or no malnutrition, which is 6 points, and where does the person fit on the frailty score, which is 2 points, and 4 points for the explanation on why you picked that score on the frailty level. Step 3 is to write a post, which is 12 points. The post is 250 to 500 words, and that's going to discuss what you've learned from your interview, and were there any answers that surprised you? How do your responses in the interview tie with or confirm the things that you've learned about in this course? How does this person's experiences and attitudes tie into Erikson's psychosocial stages? And has this changed your opinion on aging? What were your own personal perceptions on aging? And post that on the discussion board as well as in this assignment. So you're going to post the interview and the responses on that discussion, as well as upload it to this assignment. Step 4 is return to the discussion board again and pick one person to reply to. So on at least one other post, in at least 5 sentences, expand on your classmates' points in a value-adding, topic-related way, promote a collaborative, supportive community, and advance the dialogue through follow-up questions. Reply posts cannot be one-liners, cannot be off-topic, cannot be vague statements, and cannot be unsupported opinions. So if you're making an opinion, you need to support it with literature references. Inadequate explanations or simply saying I agree or good job does not count for a reply post in this assignment. So when you finish that, copy and paste it into the submission point here as part of your assignment. Name the student that you replied to. So what you're going to include in this part is you're going to include a copy of the interview, the written or recorded. You're going to a copy of the M&A with score and statement that indicates presence or risk of malnutrition. You're going to include a copy of the scoring for frailty scale and explanation of why you determined that scale. you're going to include a copy of the discussion board post that you made to the discussion, and you're also going to include the reply to another student's post from that discussion board. Okay, so that is assignment 1, older adult interview and assessment for malnutrition and frailty.